A great example of this is in 2017, there was a brilliant biomedical engineer graduate student who created an open source automatic external defibrillator, and yet it's not available. Nobody knows about it, despite the fact that it costs 1/10 of what a commercial one would and is even more safe. We want to give people like him a platform. We want to give people who are dreaming of bringing solutions to the public ways to do it. All of our designs are going to be open source. We put everything directly into the public domain the way we always have, but we want to do more than that. We want to document our process so that when people come along and want to do similar things, they understand the ways that it can work and they can avoid the pitfalls that we had to go through. We're collaborating with so many great groups. You have a long list that shows all of them, but a few include the Open Insulin Project, the Artificial Pancreas Project, Women Help Women, and Open Hardware Africa. These are great groups, and we're really happy that we're finally able to help them in return for all the help they've given us over the years. We've managed to release and start a lot of projects in the last year. We have a new version of the MicroLab that snaps together. There's a touch screen and a graphical user interface. It doesn't require a computer to use. With the eyes of the world on COVID, in February, we released a pamphlet on survival. Also, the data science team managed to find a used supercomputer that allows them to find synthesis pathways for drugs that are simpler, with fewer steps, and greater margins of error. We've been working on another drug delivery system that is used in the pharmaceutical world, but not implemented very often because it's not cost effective on a large scale. This is the subdermal plastic drug delivery system. We've also been working with the Open Insulin Project and the Artificial Pancreas Project to build a subdermal implant. Additionally, we have many more projects that we're looking into that we're trying to start to see if they're viable or not. And we will continue to do this perpetually to see what is worth trying, what needs to be dropped, and what's working really well that we can double down on.